Here at St. Charles, we used a traditional model of classroom teaching, pulling caregivers off the floor and teaching classroom-style presentation. It was a pretty costly model and difficult to manage the amount of instructors that we needed.
Getting somebody to a standard CPR education class in a classroom is always a challenge. It was very difficult to schedule to get people in there because you had to cover their shifts. And so not only are you paying for their time there, but you're also paying for someone else to cover them. People only got to practice once every 2 years. And so they really weren't that proficient when it comes down to actually doing CPR.
When the pandemic hit, our command centers came to us and said that all classes would stop. I knew we would have 800 to 1,000 caregivers to certify, and I didn't know how we were going to do that.
The staff themselves became very stressed. We have if you don't have your certification, you don't work policy.
Implementing RQI is dramatically different than our old traditional model. They didn't have to come to a classroom. They did tutorial online learning and then performed their skills at the RQI station.
When St. Charles decided it was time to move to RQI, that was revolutionary for us to be able to get people the certifications they needed.
When I first introduced the program of RQI to the caregivers, they were terrified. I got comments like, how am I going to do a mega code? Who's going to evaluate my skills? But as we moved along the continuum and they did their virtual online learning and they practiced their skills at the cart, they began to see how easy it was and how much it supported evidence-based practice.
RQI is going to really open the door for the staff to be much happier. We can actually set them up to be able to do this while they're still on shift. They take a break, they go down, they do the computer part, they do the hands part, and we can actually incorporate that into their regular workday.
At St. Charles Health System, we are trying to increase our survival rates for in-hospital cardiac arrests. And RQI is a driving force in that because it increases caregiver competency and confidence by 98% after the first year. And we're able to monitor that through the RQI data and quality process.
One of the benefits of using RQI over the classroom system is in the classroom system, we have the diversity of those who do it all the time and those who never do it. With the RQI process, that gap is closed. That provides consistency across the system. So no matter where the resuscitation needs to occur, the response is always strong.
We saved $1 million a year. So in the middle of a pandemic, we were saving money by bringing in RQI.
If I was talking to another ED manager in a system about RQI, I would tell them that they're going to have happier staff, they can just get to use RQI on shift, and they're going to be better trained because they're doing it more frequent, and you're going to provide better care at a lower cost.
It was like a perfect fit. Bringing RQI in is now our new normal, and moving forward, that will be the new norm.